Meantime, claims that Jamaica has been hit by a wave of repatriation of Cuban medical doctors ahead of the Marco Rubio visit have been clarified. Health and Wellness Minister Dr. Christopher Tufton says much of the allegations are false. This after Rubio reasons Jamaica's partnership with the Cuba medical mission appears to be above board and commended the government on their arrangement.
Reports of Cuban medical doctors being sent home en masse had sparked concerns about the future of Jamaica's healthcare system, which relies heavily on the expertise of these professionals. Critics suggested the move was politically motivated, tied to Secretary Rubio's visit and his known stance on Cuba's labor export programs. However, on Wednesday, Health Minister Dr. Christopher Tufton injected a dose of clarity.
This is not correct, the assumption that because of the visit of Secretary of State Rubio, Cubans are heading back. The reality is that the mission allows for medical professionals to come for a period. As it turns out, and maybe coincidentally, this period has now come to an end for a number of them. And so a number will go back for others to come. In some instances, extensions are granted, but it's granted up to a particular point. The other coincidence, if you will, that is taking place is that currently we are renegotiating the MOU with the Cuban government. So there is a conversation that is taking place, looking at the existing MOU, looking at the possibilities for change.
The Cuban medical mission has been a lifeline for Jamaica, filling critical gaps in the healthcare system, with scores of Cuban doctors, nurses and technicians currently serving in the country. The minister assures the arrangements here are at internationally accepted standards.
We have also maintained that the Cuban program has been very beneficial to us. We have seen hundreds, if not thousands, coming to Jamaica and providing valuable service in our health space. And we have also said that in terms of our treatment of the Cubans who come, it has been no different from our treatment of our locals, except for any additional support based on the fact that they are not local. So transportation, logistics, housing, and so on, which we would provide for any expatriate that would come here working in the government space. So as of now, nothing changes.
And during his visit, U.S. Secretary of State Marco Rubio lauded Jamaica's handling of the Cuban medical mission, describing it as above board and a model of ethical cooperation. He dispelled misconceptions about U.S. opposition to the program, reasoning Jamaica's approach aligns with international labor standards.
I think we can all agree that the trafficking in labor, be they doctors or farm workers, is not something that we would want to be supportive of, and we find that to be an egregious practice on the part of the Cuban regime. Now, every country operates their program differently. And obviously, because of our relationship with Jamaica, we're going to engage with them on that and talk about it further and have a better understanding. Perhaps none of this applies in the way it's handled here, but generally, that's the problem with the program. It's not that they're Cuban doctors. It's that the regime does not pay these doctors, takes away their passports, and basically it is, in many ways, forced labor. And that we cannot be in support of. Again, not speaking about here in particular, but in general about the program.
Trisha G. Kelly, CVM News.